Okay, thank you for joining me tonight for this special town hall on COVID in our schools. I appreciate having the board president joining, as well as the superintendent and staff and Dr. Bolton. I just want to say that this is so important. I don't think, even though we, on one hand, understood that the pandemic was going to be unpredictable in many ways, I don't think when school started, or when we were approaching, that we knew there was going to be a fourth surge at the same time. And that on top of that, it was going to impact children more than with that variant than the previous. And so a lot is happening all at once. And so I just feel it's incumbent upon me as a board member to reach out to my constituents as best as possible, to make sure that they got the information that they needed, as well as any questions that they have. And so I appreciate everybody who's joined in to help me with that cause. Okay. And just an update on what's going on locally in Baton Rouge in terms of COVID numbers. Like today, our hospital numbers are up to 519, and that's just in East Baton Rouge Parish in the hospital. And then 89 people are on ventilators, and a significant portion of that, unfortunately, are children. Even children, I was listening to the news earlier today, under the age of 2. And I have a grandson that's 4 years old, and they're in kindergarten. And so, I feel it personally, just like many of us here tonight. So again, I appreciate you all for stepping up to the plate and supporting the sister and making sure that I get my folks educated and get their questions answered. And I want to give the board president, I'm Madam Vice President, I want to give the board president an opportunity to just greet folks and share your thoughts, David.
Well, thank you, Vice President Collins. It's a pleasure to be here, and I want to welcome everyone. I want to thank you for your leadership in putting this together. And it's these kind of things to inform parents and to inform the community of what we're doing are so important. I also want to thank Dr. Narcisse and all of his team members, all of the members of the EBR team who are working so hard to get our children back in learning mode and helping us do everything that we can to protect our children while providing good quality instruction and helping our kids have some normalcy. So on behalf of the entire board, I want to thank everyone for their commitment to what we're trying to do, and especially you, Vice President Collins, for your leadership. Thank you so much. It means a lot to me to be here and to be a part of this. And of course, as you know, and everyone knows, I'm here to do anything and everything that I can to help and assist. So thank you, Vice President Collins.
Thank you so much for joining us. And so just mentioning who we have here tonight and how we're going to proceed. We'll start with Dr. Bolton, specialist in pediatric infectious disease over at Our Lady of the Lake. He's going to share some updates on what's going on and give us some better insight. We will then go and we'll hold all questions towards the end. Please use the Q&A box. You can put stuff in the chat, but it'll help us out tremendously if you put it in the Q&A box. If you have a question, comments, put them in the chat. Questions, put them in the Q&A box. Okay. And so then we'll proceed. We have several representatives from the school system. First and foremost, of course, our superintendent. Thank you, sir, for joining us. Then we have Dr. Michael Robinson, Chief Academic Officer, Sharon Williams, Chief of Schools. We have Stacy Dupree, who will be doing an overview of our COVID protocols for EBR school system and our safety precautions. Sister Alex Stubbs, our Chief of Communications, is on as well, holding down the fort on the back end, helping us with this tonight. And then Teresa Porter is Director of Magnet Services. So I know folks with the magnet, My grandson was in the magnet. He dropped and he did virtual because as a family unit, we are able to support. And I know not every family can support a virtual learning, but we are. Dr. Charmaine Rutledge, she'll, any questions you all have with curriculum, Brandy Williams with gifted, and then also Brother Adam Smith to answer any questions with exceptional student services, ESS, and then Brother Cesar Rico helping with ESL, English as a second language. All right. And so first I'm gonna start with Dr. Michael Bolton, and I'm gonna spotlight you, Dr. Bolton, so everybody can see you clearly. And you can proceed. And you know what, Dr. Bolton, if you can, as you share your credentials, if you don't mind, just briefly, how you came into pediatric infectious disease, your story on that.
Yeah, thank you so much for inviting me and giving the opportunity to speak during, as you said, this unfortunate fourth surge. So I'm a pediatric infectious disease specialist at Our Lady of the Lake Children's Hospital here in Baton Rouge. I'm originally from Alexandria, Louisiana, and I graduated from Bolton High School, actually. I did undergrad here in Baton Rouge at LSU, and then did medical school at LSU Shreveport. And then I stayed on in Shreveport and did a residency in internal medicine and pediatrics. I realized I like taking care of kids a little more than I'd taken care of big people. And so I decided to pursue an infectious disease fellowship at Nationwide Children's Hospital in Columbus, Ohio. After spending 3 years in Columbus and completing the fellowship, my wife and I did not enjoy the winters in Columbus, Ohio. And so we wanted to both come back to Louisiana. And Our Lady of the Lake Children's Hospital was a perfect opportunity for us to come back and call this home. And we've been very blessed to be able to do that for the past 10 years. I chose pediatric infectious disease because it's selfishly, it's a lot of fun. We get to basically play with kids all day and get paid for it. And so it's a lot of fun to do that. When there are infectious diseases involved, a lot of times they're sort of mysterious. And so trying to solve a puzzle is something that I really enjoy doing.
Like the TV show House, but with kids.
Sure. We don't do our own brain biopsies though.
Right.
I hope I'm not like House in a number of
right. Yes. You don't seem to be.
Yeah, I hope not. My kids might disagree. Who knows? So no, I really enjoy pediatric infectious disease. It's this pandemic has certainly been a unique situation, even for my mentors who have gone through a number of different things from an infectious disease standpoint to be part of this and having to share scientific knowledge and create different things to help the nation with this pandemic. It's certainly been a challenge, but also pushed science as a whole to come up with how best to treat kids, how best to treat adults, and miraculously come up with a really safe and effective vaccine. And so we're very blessed to have that, and which is why, to your point, Madam Vice President, the idea of having a fourth surge during a time where we have a safe and effective vaccine is disheartening. This is a vaccine that kids cannot, for the most part, receive at the moment, and so I was extremely hopeful that we as adults would take the accountability and get a vaccine and protect our youngest and most vulnerable kids in the community. But as you point out, more and more of the positive COVID cases we're seeing in our area and in the state and nationwide are children. And most of them are children who are too young to be vaccinated. When you look at our vaccination rate for the kids who are eligible to get vaccinated, Louisiana is pretty darn low in that regard compared to many other states. And so I know many folks, including on this call, have made tireless efforts to try to get kids and other adults vaccinated. And I think that's something we need to continue to strive to do especially as you noted during this time of the Delta variant. You know, more and more kids represent the positive tests that we're seeing for COVID. We're seeing more kids in the hospital. We're seeing them more critically ill. I'm on call this week, and today alone, I think I saw the most COVID kids I've seen during the pandemic today. And some in the ICU, and some are not in the ICU. Some are teenagers, some are not teenagers. And so we think about what we see, especially the ER physicians, the ICU physicians in our children's hospital, the amount of effort and sweat they put into taking care of these kids, along with the nursing staff and all the other frontline providers. You know, it gets to be quite a bit, knowing that there is essentially a prevention for this virus, and not enough adults in our community have taken advantage of that to help protect those kids. And so, you know, we're seeing more kids in the hospital with COVID. We're seeing more in the hospital with other infections that typically occur in the winter, but we're seeing them more in the summer, things like RSV. And the reason that's of concern is with school starting now, the risk for some of these infections to spread, which is why I agree with the governor's recommendation to do masking indoors for all individuals, not only in public places, but also in schools. And I think it's a great way. It's a great tool that we have to try to prevent the spread of infections, not only COVID, but other infections as well. And so I think that's going to go a long way to help us sort of try to flatten the curve of this fourth surge that seems to be the most pointed surge so far that we've had during the pandemic. And so I'm happy to answer questions. The thing I would strongly urge folks on this call to do, or listening in, if you haven't received your vaccine, please sign up and go get your free vaccine. If you don't do it for yourself, do it for your children, do it for your grandson, do it for your niece, do it for those who are unable to get a vaccine to be safe. But I'm certainly happy to answer any questions, as you mentioned, Madam Vice President, that come up in the chat.
And then, you know, just real quick, before I move on to the school system, tell us more about what you're hearing. You know, I'm trying to be healthy at the tender age of 45. I was starting to sound like an old woman when I was getting up from chairs, and, you know, and so I started doing Pilates. I'm so proud of myself. I tell everybody, you know, every chance I get to tell people I'm doing Pilates at 6 o'clock in the morning when I'm not a morning person, on Tuesdays and Thursdays at the Y. And so I bring that up because like the past 2 weeks during this surge, I you know, people talking in the locker room, and there's this lady, and I think she's our lady in the Lake Children's, Patsy, where she's a nurse, and she had been, you know, just frustrated. She talking with, you know, gym talk with folks she loves swimming with, and I mean, the things that she's seeing and hearing, and I'm just eavesdropping. She probably didn't even know I'm in the, you know, but you know, frustration from folks not getting the vaccine. I know myself, I got the vaccine, I got Moderna in April, and I wasn't in a rush. Like, I wouldn't like, oh, the vaccine came out today, let me go. You know, I'm gonna just be honest. I took a little time to see if my coworkers, you know, was anybody gonna pass out. You know, like, I mean, just honestly, because it is a new vaccine, and you know, with new medicine, you have that hesitancy. And then, you know, in particular, you know, besides the conspiracy theories that are on social media, etc., then, you know, also too, as a Black female, the history of things, not just the Tuskegee experiment, although that's one of the most known, you know, that additional hesitancy. But I went in April, after at least I saw that my coworkers weren't falling out and whatnot, and I'm fine. You know, I mentioned that to say that I'm fine. In my family, my mother, I got Moderna, my mother had Pfizer, my sister is a part of the Johnson & Johnson trial. So all three of us, like, you know, comparing notes or what have you, and all three of us are doing well. On your end as a physician, or what are some community concerns that you're hearing when patients come in with COVID, or just as you're interacting and people know you're a doctor and you're talking, what are you hearing?
Yeah, no, it's a good point. You know, I think having this session on a social media platform, I think is a great idea to try to get a better reach to provide sound medical evidence and try to dismiss any, as you mentioned, conspiracy theories that really take hold and frighten people from getting a very safe and effective vaccine. You know, and you mentioned this is sort of a new medicine and certainly a new vaccine because it's a novel virus, but the technology that was used to make this vaccine is not new. It's been actually around for a couple of decades, and companies are actually looking at the success of this vaccine and can it be used in other vaccines, including like the flu vaccine, in years down the road, because it's been proven to be so safe and effective compared to many other vaccines, and how quickly this vaccine was developed shows that when variants like this develop, drug manufacturers can be more nimble in creating vaccines that specify how they act against certain viruses. And so it's a new vaccine because it's a new virus, but the technology has been around for quite some time. So we're very excited about this vaccine. And when you think about how many, 150, 160 million Americans have received the vaccine so far, and it's compared to vaccines in the past, this is remarkably safe and tremendously effective. What we're hearing is things we hear on social media, right? So it causes infertility. You're going to get COVID from the vaccine. You are more likely to be hospitalized because of the vaccine than from COVID itself. That it'll be integrated in your DNA. None of these are true. None of these are actual things that can happen. And so, you know, so I applaud you for putting this on social media as we try to reach this number of people who get more of their news from social media as opposed from medical providers or their own providers. And I think having this as a forum where people can ask questions to the community, I think is a great way, because what we're seeing is trying to get folks vaccinated. They're going to listen to their community leaders, people they're close to. They're not going to necessarily listen to me. And so the more that you can speak on your behalf and tell your story about your COVID vaccine and what you went through and your thought process and how safe it was, I think that goes a long way in helping folks around you in your social network who might be on the fence to then get vaccinated.
And then, if I remember correctly, because I know Baton Rouge General, Our Lady of the Lake, and Ochsner are putting the numbers together and publicizing and showing those total that are in the hospital, and of that, how many are vaccinated versus unvaccinated. And today, I think 59 of the 500 or so are unvaccinated. So that's roughly 10, 11%. Well, yeah, 11, 12%. So yeah, some folks vaccinated have gone to the hospital, but I mean, the comparison.
Yeah, you're right. Yeah, the vast majority who are hospitalized are unvaccinated. And in the children's hospital, that's what we're seeing as well, is that the vast majority are unvaccinated. And, you know, no vaccine is perfect. So that's why you still see some breakthrough vaccines. And the more widespread the virus is, you're going to see more folks who are vaccinated get the virus, because it's just so widespread, you can't escape it. But the virus is a living thing. And so the virus is going to want to do things to survive, and that includes mutations. And so it's going to do whatever it can to continue to survive, move to a new host, and survive. And that's what these variants represent. And so in this Delta variant is just one that has done a really good job of making new homes in people, namely unvaccinated people. And so the more folks who are vaccinated, the less of an opportunity the virus has to find a home and do different mutations and then spread to other people. And so this is why we're seeing, more of an outbreak with COVID now in the South with the vaccination rates here versus states in the Northeast or the very Northwest which have higher vaccination rates than places in the South. We're not seeing those rates of COVID at this point. Because
Okay.
more and more people travel, when they come in contact with vaccinated people, even the vaccinated folks may get the infection. But the studies have shown that even if vaccinated folks get the infection, they are so much less likely to be severely sick or die with COVID than those who are unvaccinated. It's actually very tremendous, the difference between vaccinated and unvaccinated folks in their outcomes when they get COVID.
Thank you. And then the latest variant that there's some new concern about is the Lambda variant.
Yeah, and there's going to be a couple of different ones that probably come out after that. And there, there was the one from the UK. There was a one from South America. There was a California variant. And so again, the virus is going to do things it needs to do to try to survive and find new hosts. And so, and once it finds something that makes it really easy to get from person to person, like the Delta variant, makes it a lot more conducive to spread person to person to person. And so, yeah, the more people are vaccinated, the less success the virus is going to have to mutate and have new variants.
Well, thank you so much, Dr. Bolton.
Good thing.
And thanks for sticking around. I know you're going to go take care of some you're going
Yeah,
to
no,
in the kitchen, but you're going to be on standby for the Q&A.
Answer your questions for a little bit. Absolutely.
Cool. Thank you very much. All right. Superintendent Narcisse, you ready for us?
Yes, we are.
All right. Thank you again, Superintendent, for joining. And thanks for getting all hands on deck. I appreciate it very much.
Thank you, Ms. Vice President Collins. We are excited to be able to answer any questions that people may have. As you know, we have the COVID guidelines that we put on the ebrschools.org website, as well as a COVID page. But we know that we are in the process of, we're in our second day of school. And so we have many different folks, as Vice President Collins has said, on the team that's on the call that can answer questions that people may have. We can kind of go through that list if that's how you like to do it, or anything else that are concerns. But we have majority of the staff on here, and we're trying to make sure that we can help family and community members to be able to answer any questions that they need to be answered.
Yeah, let's do that. We can go in order on the list. Now, I did happen to talk. We can go in order on the list. Let's start with Brother Caesar Rico. Oh, no. We need to do Stacy Dupree first. I'm sorry.
Ms. Dupree?
Yes, sir. I'm unmuting. So you want me to answer the questions on the list or do a brief presentation, Ms. Collins?
Do a brief presentation. We're going to save all questions towards the end.
Yes, ma'am. So let me see if I can share my screen.
All right. And you see the little green button at the bottom. All right. Go ahead, Stacy. I know y'all used to using Teams, so thanks.
Yes, ma'am. So I'm not going to share it the whole way, but I just want to thank you for giving us the opportunity to participate in the District 4 virtual hall.
Mm-hmm.
We're going to talk about the day in the life of a student. So let me minimize this so I'm not looking at myself.
All right.
This is a representation of what it's like for a student to go through the day. And we have this on our website, but I wanted to take a moment to just go over this with our community and our public. Some questions we always ask: should my child go to school if they're ill? Of course, if your child is not feeling well, please contact your school, your child's school, and let them know that they're staying home. We will do all we can to make sure that they don't miss any assignments or any work. Students, teachers, and staff should stay home when they have any signs of infectious illness. If an individual has a fever of greater than 100.4 degrees or any signs of illness, they're not going to be able to go into the building. So what happens on the bus? As y'all know, all students pre-K through 12 have to wear a mask on the bus. There's a seating chart for all the students, and the windows are kept open for additional ventilation. And of course, the bus operators clean and sanitize the bus after each route. So my child gets to school. What will happen when my child arrives to school? So all students in K through 12 will be wearing a mask. Students who are aged 2 through 4 may wear a mask if it's tolerated. And of course, we'll have disposable masks will be available at the school site. Temperatures will be checked. Students will be provided hand sanitizer as they enter and exit every room, and schools will have limited entry and exit points, and students will travel in a single file line. So what happens in the classroom? And I think this is one of the questions that are in the Q&A. Students will be given hand sanitizer upon entry and exit of the classroom. Desks will be sanitized between each period. In the classroom, students can be seated 3 feet apart. It's 3 to 6 feet, but with masks 3 feet apart. Desks in the middle and high schools will face the same direction. Adults shall maintain 6 feet of distance between themselves and students at all times. And if there's any materials they share, they will be sanitized between each use. Students will wash their hands every 2 hours. If anyone shows any signs of sickness, they'll be brought to the isolation room. Students with disabilities will receive their special education and related services in the least restrictive environment as outlined in their IEP. And students will remain in their cohort groups as much as possible throughout the day. So what happens when my child is moving through the building? The students will move in the same direction. There are directional flowers, one-way flow of traffic. Students will walk in a single file line while maintaining the appropriate physical distancing. So a question is, in the classroom, they can be 3 feet apart. What about in the other areas of the school? They must maintain that 6 feet distance. That's outside, inside. We need to make sure we keep that distance outside the classroom. Masks will be worn at all times during the transition. Our water fountains will be closed, but we have water bottle filling stations across the campus, and our restrooms are cleaned and sanitized at least 2 times a day. So this brings the question, well, if they have to be 6 feet apart, how are they going to eat? So classrooms may be utilized for eating in place. Many schools already have it in place. It looked great the first few days of school, and they're eating in the classroom. Some of the younger students, as you know, maybe a little bit messier, they are eating in the cafeteria and they are 6 feet apart. So students entering and exiting the cafeteria go in particular entrance and exit lines, and everything is labeled in the school. Everybody wants to know, can you participate in PE and recess? As a mother of a child, a very active child, PE and recess was essential to his behavior in class. So yes, students will be able to participate in PE and recess. We will follow the outside and non-classroom 6 feet apart distancing. If we're outside, barriers are not required. PE equipment will be sanitized between each group, and a daily cleaning checklist of all common touch surfaces is used to make sure we sanitize everything appropriately. So what happens when we leave for the day? Students will exit the classroom in a single file line, will exit the building following directional markers on the floor, and students and adults will maintain that 6 feet separation, and students will be in their assigned seats. What happens after my child leaves for the day? All classrooms and restrooms will be cleaned, sanitized using the antiviral cleaner and disinfectant approved by the EPA. So this is the question I get the most. What happens if my child is ill at school? And it happens. If a child is ill, they will be escorted to the school's isolation room. The staff member will notify the principal and school nurse about the ill student. The ill student's parent or guardian will be contacted so they can pick up the student within 1 hour. The school nurse will provide initial and follow-up guidance, and the ill student's parent or guardian will complete and return a symptoms letter to the school guide according to school guidance. The custodial staff will clean the school's isolation room every time there's a child in there. Now, there was one question that I've received from a number of parents in the last couple of days is what checklist are you using for COVID symptoms? Because last year it was one major symptom and 2 minor symptoms. This year we're following the revised guidance, which is any symptom of COVID needs to be brought to the isolation room and to go home with their parent. So the next question is, was my child a close contact of someone? So everywhere except for in the classroom, if a student or staff is within 6 feet of a confirmed positive case for more than 15 minutes in a 24-hour period, they're a close contact. But in the classroom, if both the student who's positive and the other student who's not positive, the close contact, wore their mask correctly over their nose and mouth and it's fitting correctly, and they were 3 to 6 feet within each other, they don't have to quarantine. So if my child's a close contact, they're brought to the self-quarantine room. Close contact letter is given to the parent or guardian. The pre-K sites have to do 14-day self-quarantine for all non-vaccinated individuals, and the schools that are K through 12, excluding the pre-K classrooms, have to do a 10-day self-quarantine, and then 4 days of symptom monitoring. This is all for non-vaccinated individuals. How do we find out if there's a case on campus? So every student who's a close contact is notified, and the parents are told that they're a close contact so they understand the guidance of what needs to occur. If a student is not a close contact, every student in that bus or in the classroom will get a letter saying, there was a case on the bus or the letter, but you don't have to self-quarantine, you're not a close contact, no action is needed. But irregardless of that, all parents or guardians and staff members will be notified each day there's a positive case at the school. So parents, I've received a number of calls on our hotline about this. What do I do if my child's a close contact to someone outside of school or they have COVID-19? Please contact your child's school for assistance. We will follow the same guidelines for self-quarantine and self-isolation, and we will work with that parent to make sure they have all the makeup work that they need. And on the next slide, our COVID hotline. If you have any questions, you can reach us at COVID hotline at ebrschools.org or at 225-397-2210. And this is also on our website. So Madam President, I'm going to try to stop sharing. Thank you.
Amazing. You just like a pro at it. Okay. Okay, so again, we'll hold questions until the end. Thank you so much for the presentation. Those that put some questions in the Q&A as people make presentations, I don't know if it lets you pull it off, but what I'll do is if it sounded like your question was answered, once somebody did a presentation, I'll just type in question was answered. Go back in if there's a specific thing that was not addressed. Audience. Okay. All right. So then let's move forward. I have, we're going to go to Adam Smith and then Cesar Rico. I have two. So Adam Smith and Cesar Rico. Cesar, you're going to correct me on your name pronunciation, please, sir, when it's your turn. Mr. Smith, you go ahead and then and share with us from the ESS Department, Exceptional Student Services.
Thank you, Madam Vice President, President Tapman, and Superintendent Narcisse. I don't have a presentation like Stacy so eloquent had one, but I'll be very brief, and I'll type in my email address in the chat form. So if anyone needs to reach out to me, they can reach me via email. But I'm Adam Smith, one of the associate superintendents in EBR, and I support what Mrs. Collins said, the Exceptional Student Service Department. For those who are not aware with that terminology language, it's the special ed department, students with disabilities. Right now, our department is currently trying to support our families to make certain that our kids are meeting the requirements as far as with their IEPs. We have families currently right now who are electing to enroll in our virtual school. And right now, staff is meeting with parents to ensure that we amend those IEPs to an appropriate setting. During this COVID environment, of course, we still provide services as mandated by the IEP. The IEP is illegal, which, let me try to correct, not use the acronyms, the individual learning plan. I saw a comment, someone had written SPED, and the question was, what is SPED? And somebody came back and explained it's special education. So let me try not to use the acronyms to confuse anyone. The individual learning plans, which is a federal contract between the state and the school district, between the parents and the school district. And so we want to make certain that our kids with students with disabilities, that they meet progress towards their IEP goals. And so we're here to support families to ensure that our students with disabilities have access to the general curriculum, and that we provide that free and appropriate education for our kids. And so my email address is asmith22. I'll type it in the chat box. And if there are any questions, I have to leave you guys. I have my godson is moving on campus, and he didn't follow protocols that's with his vaccination to get back on campus. And so I appreciate the opportunity to chat with you guys, but if you have any concerns, feel free to reach out to me at asmith22@ebrschools.org.
Thank you so much, Adam. And Brother Cesar Rico. Is it Caesar or Cesar? Say it for me.
Good evening, Ms. Collins. Yes, it's Cesar Rico. Look, if you can say Cesar, you can go ahead and do it. You know, if not, Caesar's perfectly fine. I'm kind of used to it. But Cesar is exactly right. You got it right.
I did it. Okay. Thank you.
There you go. There you go.
All right.
Yes, we're with the ESL Department, which is the English as Second Learners, and we represent our EL population, which is our English learners. Our primary goal, of course, is to provide proper and equitable academic services to our kids who either speak a different language or come to a different country, but we do way more than that. When they come in here, we support their families socially, making sure that they get what they need, of course, to go ahead and be successful at schools. I want to go ahead and just really thank you for hosting this tonight, because one of our biggest things that we work with in the ESL department is communication. And with that communication, we want to make sure that everything that we are communicating is clear, is coherent, of course, you know, and we want to make sure that we are doing our best in translating with our families so that way they are in the know and they're updated with any type of protocols and procedures. Just like the presentation that Ms. Dupree said, we're making sure that everything is actually translated as best as possible in different languages. Of course, Spanish being the main one in our city, but also Vietnamese, Arabic, and other forms as well. But safety is our top priority at the moment, because we want to make sure that our families and our kids are as absolutely safe and healthy as possible. With that being said, as you can imagine, we get a lot of questions, whether it's at the individual school site or whether it's around the central office. And with all this, we want to make sure that they're getting the proper information that they need, so that way they can succeed and stay healthy. So all these protocols that we're discussing, communication is probably one of the best areas that we're working on closely with our families. The community involvement is also very big with us, okay? We want to make sure that our community is involved, so they actually know the hard work and the supports that we have here in EBR School District. And we want to make sure that they're also our close allies, so that way we are trying to go ahead and spread the message to stay healthy and safe, and at the same time, making sure that they're getting the proper instruction and academic supports that they need. So in behalf of all of our students and our families that speak different language and everything, you know, muchas gracias por todo. We really appreciate you hosting this tonight, and we look forward to working closely in the future as well.
Thank you so much. I
Absolutely.
definitely have a high percentage of Spanish speaking as well as Vietnamese in my district. So, you know, when I type up some information, and I need some translation, I'm gonna be hitting you up. And you know, especially if there happens to be anybody that's participating tonight that is part of the ESL population. You mind putting your email, your email address in the, because
Absolutely.
they might need clarity on something someone said, and because of the language barrier.
Yes, ma'am. We'll be more than happy to. I really appreciate you. Thank you.
Thank you so much. And look, I don't want people to feel like Stacy was the only one that just came prepared. Stacy was amazing, and everybody is coming together to help me. I only ask that people, the other departments, do just a little quick 3-minute update on what's happening in their various departments and to be present for Q&A. So thank you so much, Stacy, for being uber professional. And I just want to make sure everybody knows that Stacy not the only one. Everybody doing what Miss Collins asked. asked. Okay. All right. So moving forward with my other list, we have brother doctor. I like to clown. Okay. So brother Dr. Michael Robinson, Chief of Academics. If sir, if you could share what's going on in your neck of the woods.
Good evening, Ms. Collins, President Tatman, Superintendent Narcisse, and to those members that are listening, to all of our families, and to my colleagues. Thank you so much for the opportunity to be here tonight and to engage in this event with you. We really are very appreciative, and we're so excited that our scholars are back in school. And we know, in spite of all of the things that are happening with COVID, we're going to happen, but we are really excited to see them back in person. So it really makes for a much more enjoyable experience for them and for our teachers. And we're very excited to see our teachers back as well. In the Division of Academics, which a lot of those departments are being represented tonight, we are really working to ensure that schools receive the materials that they need. Some of those materials may not reach the schools until the middle of this month, like next week, but most of the schools have already received their materials. We're working around professional development, which is going to be a process in and of itself to ensure that all of our teachers and our administrators are receive the training that they need around professional development, around the initiatives that we'll be doing this year. The good thing is that we'll be doing Achieve 3000 to support ELA and literacy, but also in math. We'll be doing Dreambox, and that will support our students, whether they're in person or if we had to be at home in another, but we're focusing on strictly being in school and being in the brick and mortar. So we're looking forward to that. But we have a lot of great, exciting things planned for our scholars this year. And we're definitely looking forward to working with them across the system. And so again, thank you for the opportunity to be here tonight. And we're very, very glad to have had the opportunity to participate with you.
Okay. And then forgive me if I'm putting you on the spot. Anything going on in which you have your hands on that COVID is directly impacting, and how you responding to it?
Well, the instructional component for us is not necessarily going to be impacted by COVID, because if we had to, go home for whatever reason, we'll be using Canvas as well as Google Classroom, but we'll be using Canvas to help support our teachers with lessons that they can put there, and the students can actually submit their work and teachers can grade it. So we can still function. It won't be as easy because we won't be in person if we had to go home, but we could still continue to carry on with the curriculum, with learning, teaching and learning will still continue.
Thank you very, very much, Dr. Robinson. Sharon Williams, are you a doctor as well?
Yes, ma'am.
All right,
Good evening.
Sister Dr. Sharon Williams.
Thank you. You can call me Sharon. I'm your chief of schools. And I'll just say good evening to everyone. Thank you for the invitation, Vice President Collins.
Thank you.
Our division is focused on supporting our school leaders in schools. We have 85 schools in our school district. That includes our Type 1 charters. They're all of our schools. And we're working hard to make sure that the school year starts smoothly. So we'll say my primary responsibility is helping our executive directors for school leadership who are in the field every day, working with our school teams to support them in whatever way possible. We have been meeting as a team each day. Well, each day, it's the second day of school. We're meeting each day until August 20th to ensure that all of our processes are in place with schools. We're debriefing with all of the other divisions that are represented on this call tonight to make sure that each of our students are safe and that they're being educated to the highest degree possible during this time frame. I will say that our school leaders are working very diligently and they're very vigilant about safety procedures in our schools. What we've done previous to school opening is to ensure that each school has a plan and that they have practiced their plan so that when a student may become sick or a staff member becomes sick or is showing symptoms, each person in the school who has a responsibility for the safety of the school knows what to do in those cases. I will say that, again, schools are being very vigilant about our procedures regarding COVID and being very safe in this area. They're supporting families and students as they can day to day with the help of our colleagues on this call, especially Ms. Dupre's office, being our main support regarding students who may find themselves in quarantine or needing to go home because of COVID-related illness. One other aspect of my responsibility now is to help stand up our EBR virtual academy. And this has been a Herculean task, as you can imagine. We had to shift very quickly on a dime as the COVID numbers began to rise in our parish. The team there consists of a very capable principal, assistant principal. Our executive director for school leadership has great background experience in helping to support virtual schools. And we have, as of this afternoon, over 700 students who have registered for our virtual academy. And that is up quite a bit from our projections earlier in the summer and spring when we were planning for the opening of our virtual academy. I do want to express my thanks to everyone on this call who has assisted in this task. It has taken the team, including Ms. Williams and Ms. Porter, particularly for those families, and Mr. Smith, families who have children in specialized programming. It's important for us to make sure that those students maintain their spot in those special programs and then also receive the services that they so richly deserve in the virtual academy. So thanks to my colleagues around that. Also, just throwing all resources to help families register for the virtual academy has been quite a task over the past week. So I appreciate the public's patience with us as we're standing up a school that we have never stood up before in this way. So I appreciate all the cooperation regarding that. I will say that we'll continue to be vigilant. We're continuing to meet as a team to debrief and get better each day for our scholars in schools. And we're getting better every day. I know that there have been some transportation glitches, and perhaps a colleague will speak to that. But we're working on those and working through those every day, and very close contact with everyone here on this call to make sure all of our students arrive at school safe, are safe throughout the day, and return home to their families safe.
Thank you very much, Dr. Williams. I appreciate that, and I'm grateful to the virtual school efforts myself. As I mentioned at the very beginning, Mr. Eden Stefan Collins in kindergarten is transitioning into the virtual school as we speak. And so Gigi will be having him next to me at the home office on many days. And so, but I appreciate being able to do that and support my grandson, and that to have the opportunity to support my grandson in that way. And so now we'll move forward with Sister Teresa Porter.
Sister Teresa Porter. Good evening, everyone. And Vice President Collins, thank you so very much. President Tapman and Superintendent Narcisse. I am the Director of Magnet Programs, and as Dr. Williams pointed out, we have been working tirelessly, building as we go, an initiative to help parents feel comfortable about the process. What Dr. Narcisse's vision is for students who, or rather parents who choose the virtual option, to have their seat held if they so wish to do so. So we have a plan. We parents have an agreement. And once that agreement is signed, then we will mail them an assurance letter, because we want to make sure that they feel comfortable about going virtual and knowing that they can have their seat at either the 9 weeks, the semester, or at the end of the school year. So we have a frequently asked questions on the website, and I will post that in the chat. And also parents are free to call the office number, and that's 225-922-5443. And then we have a dedicated email address, magnet@ebrschools.org. So there are a number of ways to get in touch with us, and we are here to help and make sure that parents feel comfortable, because you're right, this really did take us off guard. So, and thanks to my colleague for working with the Magnet Department, helping us out, because this was actually building a bike as we were riding it.
Thank you. Thank you, Sister Porter. I like to, I'm a solidarity girl, so that's why I'm big on brother and sister. So, but thank you, Sister Porter. I appreciate you updating everybody on that. I know a lot of Magnet and Eden Stefan Collins is one. He's at the Belfair Montessori, the great Belfair Montessori. And so it's comforting to know that he'll have an opportunity to return once we get past this Herculean pandemic that we are facing. So thank you all for everything you're doing. And then last but not least, we have Sister Brandy Williams with Gifted, and then we'll go straight into Q&A.
Good evening, everyone. And thank you, Vice President Collins, for allowing us the opportunity to speak, Superintendent Narcisse and President Tapman. I'm Brandy Williams, Supervisor of Gifted and Talented Programs, and we are offering options virtually for our students. We were very excited to welcome our students back yesterday face-to-face, but we are also glad to have an option for parents that choose virtual. With our office, there will not be a hold letter that is necessary. All of those IEPs would be redone. That is a legal document, so placement will be held for those students. And we will eagerly welcome all students back to the face-to-face setting when parents choose that option to transition. So we've been working to support the virtual program, the virtual school. We appreciate Superintendent Narcisse's vision to offer this for our students and our parents who choose. And we do have someone on site daily to help support the transition for our parents and our families in the community. So if you do need support and you choose that option, I will put my email address in the box and also our office number, and we will be able to help you and assist you with it so that it can be as seamless as possible. So thank you all for the opportunity.
Thank you very much. All right, so let's go to Q&A. And the first question I have is from Cheryl Peters. Is there an ETA on the plexiglass? When do we expect plexiglass to be available to students in the classroom? Superintendent, I think I saw Brother Frank over there with you.
Yes, Vice President Collins,
Hi,
Mr. Chester is here.
How are you, Vice President Collins?
Doing well, and yourself?
Well, I am doing very well, thank you. I know we had talked about the plexiglass, and I believe we have ordered it so that we can make sure that the people that have requested this plexiglass will be able to have it, which also has the shields, because some people need the shield, especially when we're dealing with some of our student population. And especially, you know, some of the nonverbal types of requirements that we have. So we are ordering some shields for them that will also have the cloth flap to deal with the absence of the mask itself.
Okay. Okay, so then did we also, so in addition to the face shields as an option for those who have medical reason or what have you for now?
Yeah, and also for the kids, it's really we have, you know, a population of our students who it's important for them to be able to see facial expressions, etc. from our teachers. So we want to make sure that we've ordered the face shields, as I said, with the cloth covering for that. Where we need to have the plexiglass itself installed, working with our facilities to make sure that we have that installed where it's being requested.
Okay, so then the plexiglass is something that's by request?
Yes, I mean, primarily that's exactly right. I don't think every place we're looking at having plexiglass, and in some places we already have it in place. Okay. But if there's anyone or any location that requires it, all they got to do is just let me know, and we will make sure that that's taken care of.
All right, and so for those who perhaps Ms. Peters needs it, or has requested, or others might want to, can you go ahead and put your contact information, your email, Mr. Frank, in the chat box?
Absolutely.
And then that way people could just reach out directly to you and get follow up on that kind of stuff. Thank you so much.
All right.
And so then the next question is from Miss Frankie Robertson. How many additional personnel were hired to carry out the COVID safety plan? Were there additional personnel that were needed? And if so, you know, how many, what were they needed for? Or if no additional staff were hired, were there COVID specific duties that people needed to take leads on? And you know, how was that handled?
Yes, Vice President Collins, what we did was we didn't hire additional people. We did move people around. For example, move folks for the COVID hotline. There's some other moves that we made, but I'll let Miss Stacy Dupree respond because a lot of the shifts under all of COVID has, for medical purposes, stayed in her department. Stacy?
Ms. Collins, can you hear me?
Yes.
Okay, thank you. My internet was sporadic. So I think one of the other questions was about the COVID hotline and how many staff members and are there medical people on the COVID hotline? So I'll try to address 3 for 1.
Perfect.
We have our nursing staff, which provide support. We are building out and hiring as we speak our additional nurses. As you know, there's a shortage of nurses, but we are seeing an influx of nurses who want to work in the school setting, which is a wonderful thing. So we hope to have those extra positions filled. So we will have, instead of 17 nurses, we'll have 30, and we'll also have additional staff providing support. So for the COVID hotline, I have 6 areas that work with me that are not the nurses. That's a 7th area. And they each have been trained and well-versed on the COVID hotline. And each department provides support. I have a schedule, they have the FAQs, and of course, if they get stuck, they're directed to send the call to me so that I can address the parent or guardian's call. Medical, there was a question about, do we have medical professionals? Of course, we are not medical professionals, so we have numbers that we provide for the parents where they can call the health centers and schools and get a nurse on the phone to provide support. And of course, we encourage them that if it's a medical question after hours, that they contact their personal physician, because our COVID hotline is open from 7 a.m. to 8 p.m. And we want to make sure whoever needs support to help outside the business hours with medical issues get to a medical provider. But we have resourced our staff, we repurposed, and it's making a difference. We have more one-on-one contact with students with our medical professionals.
Thank you very, very much. And moving forward with the next question. Per the Airmark contract, how many janitors are there per school to ensure proper sanitation takes place per the plan shared at the committee of the whole? And then also to, I know during the last board meeting and we talked about sanitation and protocols for that, I mentioned us having a quality assurance type of portal or what have you that would be independent of Airmark, because they have their own quality assurance stuff in-house, but as a district quality assurance mechanism, so that we're saying that ABC is going to happen, but if teachers and staff feel like they're not seeing it happen, how will they be able to go about reporting those concerns?
Yeah, on that one, have identified and assigned one of my team chiefs, Mr. John McCann, who on a daily basis is monitoring and checking each one of those facilities that Aramark is charged with cleaning, disinfecting, etc. We also ensuring and following up to make sure that the cleaning, sanitation supplies that the staff needs, that the student needs, are all there. And that's the way, one of the ways in which we're trying to ensure that we do have some oversight and we're managing the whole process that Aramark is responsible for with respect to the cleaning. And I think one of the other questions that came up was about all the staff, the janitorial staffs and custodial staffs at the schools, all are very clear on what their roles and responsibilities are with respect to ensuring that the proper cleaning takes place when it is has been identified as needing to take place. And that's usually after the lunch periods, the process that we go through for ensuring that the cafeteria is sanitized and cleaned, doing the same thing with the classrooms. All of those things are part of the protocols that the janitors at all of the schools and facilities are expected to to fulfill. Now, you know, Aramark also provides us with a cleaning report that we also use to double check to ensure that those things are in fact happening as they state they are.
Okay, and if you don't mind, I would like to make a suggestion.
Suggestions are always appreciated.
Thank you so much. So some of the background here, before you all got here, Mr. Chester and Superintendent Narcisse, right or wrong, true or false, there is a little distrust by some in the district about whether Aramark is doing, whether it's true or false. So, and I know that John McCann works extremely hard to check on sites or what have you, but it's also like 80-something sites. If I could just suggest maybe a real simple online Google form. I mean, IT or y'all deal with forms and online submissions, etc., all the time, but perhaps one centralized place that all staff can say, you know what, I see this. I know Mr. McCann is working hard, and maybe, you know, I know the janitors are working hard, but it is a lot to keep up with and do. And so let me make sure that they know about this particular incident where I realized it wasn't sanitized the way it needed to be sanitized or something like that. I just offer that suggestion because it's a lot. It's a lot to keep up with. And we have as a district, and I've had this as a concern of mine as a board member, and I'm not saying right or wrong on Aramark's part, but I have had concern in the past with Aramark having us as a district relying on Aramark to tell us they're doing their job so they can get their paycheck. You know, you know, we don't necessarily in this moment have the staff infrastructure to without some kind of centralized reporting system independent of Aramark. And again, this is before the superintendent, Superintendent Narcisse came on and Brother Frank Chester came on. And so I just offered that suggestion because the history of the distrust, right or wrong, whether, you know, the distrust is there. And so if we could have our own centralized way of keeping up, and that way McCann could, and that would help McCann too, because then he could just, oh wait, hold up, the people telling me where all the little issues are, let me just work on the issues. And so that's my suggestion, you know. Y'all probably come up with something, but I'm just
yeah, thank you for that suggestion, Vice President Collins. I know we spoke about it. We're actually putting a process in place.
Okay.
To ensure things are actually happening. As you know, the last couple of months when I came on board with Mr. Chester, we were just observing what the process was. But we're currently now, there will be a process on follow through. We've spoken even with leaders, letting them know that there is a process coming down the pipe for that.
Okay, thanks so much. And that would just help people be at ease to know that, okay, I put it out there and it's heard and they get to it. So that's helpful. Thank you so much. Next question, Storm Matthews, the infamous Storm Matthews, one of my favorite constituents. Since she's on here, I'm gonna say what she want to hear. My favorite constituent, the favorite constituent of college. Storm Matthews. Okay, most teachers are extremely concerned about their class sizes. We cannot keep 3 feet in between students at full capacity. It is not physically possible, with some attempting to politicize masking at Bessie. Rather than it being about safety, what can we do? What can we possibly do to keep our babies safe? So she's asking for some maybe some ideas, thinking outside the box or what have you. Are we keeping all hands on deck and all brains coming together to find ways to meet our safety needs in light of everything that's going on?
Yes, Vice President Collins, we've been working for the last 2 days, also observing in schools. All week, staff has been going into schools. I know that there's adjustments that are still being made around masks, and classroom activities, but at least from the principals, we've been out to probably almost 20 to 30 semi-schools. We had different staff members going out to do different checkpoints across the 85 schools, and school leaders have said that they felt with some of their team members that things are working pretty okay. So we're going to be continuing to get feedback from our school leaders around what's going on in terms of distancing and processing and those things. But for at least the last 2 days, we haven't heard an uptick on that.
Okay, thank you very much for that. Next question, and it's along the same similar lines, offering a maybe a suggestion on ways we could work on things. From Jennifer Harding, the CDC recommends cohorting/pod learning in high transmission areas, which EBR is one. Will EBR consider small static groups for the children who are not yet eligible to be vaccinated?
Dr. Narcisse, would you like me to take this one? So in part of our guidance is the groups, to the extent possible, the younger children, especially the younger grades in the pre-K who cannot wear masks. And there may be issues with, because younger kids move around a lot, we do keep those in cohort groups to the extent possible, as long as possible throughout the day. And that is in our guidance.
Okay, thank you.
And if I could also add one other component, I know that people reference the CDC a lot, but also for us here, we sit with the Health Advisory Committee, which includes the top epidemiologists and other physicians on COVID, as well with the Department of Health that advises us on things such as what's going on in the schools, what's going on in the state. They track the numbers actually for our city itself. And so we have been really following their guidance, particularly as they also are in communication with whether it's CDC or other groups, but to kind of guide us on whether schools open, close, distancing, mask, and those things too. So we have been really working a lot closely with our folks on the committee to do that. As you know, Vice President Collins, you know, the decision around this is more than just a superintendent. It's really getting information across to make sure that we're following the science and also following what the professionals are telling us to do to kind of guide us towards a pathway. I mean, I appreciate even us getting Dr. Bolton that was on here on the call to provide what's actually going on and what's particular to our city. Because, you know, we, like many other cities, are trying to mitigate through different sets of challenges within that context. So just wanted to provide that background.
Thank you very much. Next question, and look, it's 56 questions. If I don't repeat your question, it's because, and I've said this already, but I know people be in their feelings. If I don't do your question, it's because I got 58 questions and your question was very close to somebody else's, okay? Email us if you have some more detail, because I want to respect everybody's time. People have accommodated me and they need to go home and eat. Okay. All right. So from Hannah Amoroso, will there be a possibility of vaccine drives at middle schools and high schools, even if turnout is not expected to be very high? Some parents might appreciate the convenience of having it done at school.
So we're already in talks with Our Lady of the Lake Hospital, Our Lady of the Lake and Health Centers and Schools, which are our partners. And we've already done some vaccine events, more in like back to school and other events. And we'll be working with our middle school and our high school partners, our schools, to start working on those events. Of course, we need time for students to settle into school. And we usually have to back out three weeks away from the date, because we need to make sure we have staff available and we have to have consent forms. And sometimes it takes a while for the parent to ask questions and get their answers. So we will start working on that shortly with our partners.
Thank you very much. So from Jennifer Harding, and I'm gonna put her two questions together, is around vaccinations. So the superintendent mentioned requiring proof of vaccination, much like in New York City, I believe, right? Proof of vaccination or weekly testing, since we know that COVID is transmissible, excuse me, even for those that are vaccinated, whether they get sick or not. would it be better to just simply screen all staff, everyone weekly, or whatever the appropriate interval would be? Is that a possibility to just do everybody to be screened for COVID because the person might be vaccinated, may be carrying and exposed to others?
Yes.
And then I'm sorry, and then one more question. I mean, as part of that, the public vaccination rates, will the rates, not the people's name and all that other stuff who got vaccinated, but will we publicize vaccination rates?
Yeah, so right now, let me answer the first question. As many of you have known, I put a recommendation into the board where the board will decide on the authority that they'll give me to decide whether vaccination, we as a district can make a choice. It would just come down to the board on their vote. If they give me that authority, I'll be able to do that. Right now, my recommendation is to minimally for people to show their proof of vaccination or be tested weekly. However, we are open to, if folks would like to be tested, it's an option that we can do, but it'll come down to the board to decide that at the next board meeting. But as right now, that's where my recommendation is, and but we can open to a lot of things based on the board's decision. So. And the other question that was, I just want to make sure, the other question was around the vaccination rates. We do not have numbers for vaccination rates as it's particular to EBR. We work with the parish to look at what the numbers are for the parish. As you know, we have teachers that live in the parish, and we also have teachers who live outside the parish. And so, so we look at the actual numbers that are actually in the parish. And Stacy can provide that number for us, but we don't have that. But our goal is, if we go down the road of being able to show proof of vaccination and also testing, we will have a database that we will have information to collect, which then we can share what the percentages are that way. But currently right now, we do not have a way of doing that for EBR specifically, because we have not collected information based on that. As you know, right now, some of that information is private, and there's different legal approaches that we have to put in place in order to do those things. But depending on how the board will decide, then it'll give me the authority to make adjustments accordingly.
Okay, and assuming that the board passes what you're asking in terms of the vaccine versus the testing, obviously at that point we'll start having information, and again, not disclosing who has what, but 600 teachers have been, out of 600 teachers, X number have been vaccinated.
Yes, Vice President Collins, we will be able to give percentages. We can say, for example, out of the 3,200 teachers, 3,000 are proof of vaccination, and we have some others that are not. We will have it.
All right, thank you. All right, and so then so HVAC and air quality questions from a couple of people, and we just gonna lump that up into one question because they add more questions. Hopefully I can get to as many questions as possible. So then the question is, we know that COVID is transmitted primarily through particles of air. What filtration methods have been improved now that COVID is a reality? And then along with that is, did any EBR schools improve classroom or office HVAC air filtration to the MERV 13 or higher standards as recommended by the CDC? Thank you.
Yeah, let me answer the last question first. Not all of our HVAC systems can, and I took my mask off, so I want to make sure that you can hear me. But those systems, if you can hear me, if you can't hear me, just let me know. Those systems that can accommodate the higher rated MERV filter, which is 13, we have installed those in those facilities that can handle that particular type of filter. So we've got 100% of those schools that can accommodate it. Just this morning, I had a final follow-up meeting with our engineering, external engineering, Fusion architects, looking at the type of air filtration system that we can use in the district. As you may know, there's a ton of people trying to sell all kinds of systems, but wanted to evaluate them both in light of what our HVAC system can handle. So we've looked at ultraviolet. We've also looked at something called ionization, which at this point, it seems like that's the direction we're going to go, because we can not only put it in our schools, but we can also use it in our modular buildings as well. Okay, and cost effectiveness, it's also very competitive if we were to bring these individual units and put them in the classrooms, which has its own thing, because we have kids, you have to plug these things in, and you know how kids are, they go home, somebody will unplug it, or the power goes out. So I think we've got a system that will be able to incorporate in our schools to deal with ensuring that we have the best air quality that we possibly can have. And it's about a 2-week period to be able to get these things installed. So that is where we are, and hope to finalize those plans here within the next week.
Okay, so for clarity, in summation, those units that can handle the MERV 13,
they've all been installed.
and then those that can't, we're looking at stuff like probably the ionization.
Yeah, the
machine.
ionization will put in all of our facilities to afford us with the, and you know, that's what the ratings are. We've looked at it. I'm not going to get into all the technical details, but we have that. And as a matter of fact, if at the board's pleasure, we can certainly, I can have the engineering and Fusion come in and provide even some more details just around the technical aspects of the system that we're looking to install.
All right. Okay, thank you. So then there are a couple of people who have concerns, and I'll lump them together around they observe people not necessarily following guidelines. And so then they want to know, you know, what measures are being taken to address people who, okay, mask is a mandate, or you're not making sure that your students are in your room properly distanced, things of that nature.
Vice President Collins, let me try to understand the question. So is the question that are masks a mandate when they walk into the buildings?
No, the question is when folks don't do what they're supposed to.
Oh, yes. Yes, well, when they don't do what they're supposed to, we have to address them. So, you know, as everyone knows, if you go into a school, you have to wear a mask, just like the kids are wearing the mask, and the principals will have the discretion on asking you to leave if you're not doing that. But, you know, our goal is to work with our folks to have a mask on. So, and also support that. I mean, also, there's also the governor's mandate where if you wear a mask inside, indoors, you should be wearing a mask. So we're just trying to make sure we work with folks to follow the guidelines. I know that people may feel differently about different things, but our goal is to, you know, keep our schools following the guidelines for safety. So.
Okay, and then I have a question from Nicole Scott, and we addressed this in the presentation by Ms. Dupree. What measures are being taken for the children who can't be vaccinated? What about the teachers who may be vulnerable you've laid out the protocols and the safety measures for everybody, which includes the children, teachers who may be vulnerable. If you could just touch on that a little bit, because that's a little specific. Some might need to work from home depending on how high risk they are, or other accommodations like the plexiglass and things like that.
Yeah, as for teachers, if you are in school, the in-person teachers have to come in to work in person. If they're unable to be able to do that, then we have a virtual option. We've tried to work with teachers who have not been able to come in person to see if there's possibilities for them to go to our virtual school to go teach. So that's been kind of how we've addressed that issue right now. But we are in person. When you go to the schools, kids are there, and so we don't have a simulcasting model, which is where the teacher is teaching virtually and in person. That was very challenging for teachers. We got we heard a lot from teachers around how that was exhausting and challenging, and they look forward to the in-person as long as there was clear safety protocols and those things put together. So.
Okay, and I see some people have put several questions, and only because we're short on time, if I've answered your question earlier, another question you've had earlier, let me get to some people who have not had an opportunity to be heard, okay? So with so many parents signing up for the virtual schooling at the last minute because the numbers are going up, can the district streamline the enrollment process by making it possible to scan and submit the requirement documents and forms digitally? And maybe that might even help staff too with collecting the information. Any answers to that?
Yeah, for the technical component, I know Dr. Williams is on here. We have been working to make adjustments for parents in the virtual school to make the streamline as easy as possible. We actually even took suggestions from various family members who said, hey, you might want to think about doing this. We try to make those modifications as well. So, this virtual school is a new thing for us here in EBR. I tell folks, I wish we could say we get it all right, but we're in the process of learning as quickly as possible, as well as we're making the adjustments. And so, kudos to the staff who've been working really hard on trying to ensure everything has been done right. But, it's continuously for us still a learning in that process.
Okay, thank you. Will the virtual option, so let's say, because the numbers still have not peaked. And so Ms. Erica Williams is wondering if this just doesn't plateau for a long time. Well, will there be, and maybe even force the governor's hand. Let's just say the governor's hand is forced by the numbers to say, look, lockdown, stay home. Will a virtual option be available for our kids, or will we just have to put school on pause? Will schools be able to just go virtual, or will we just say, well, we're gonna pause on attendance until that 1 or 2 weeks or however long is over?
So from my perspective, we've learned a lot from last year. If the governor decides to move in that direction because of numbers of those things, my goal will be to move us to a full virtual option across the city. I think that kids have lost a lot. I know it's been a challenge for many different families across our city. We've learned some really good some lessons, unfortunately, during the first round of pandemic. And so if that becomes the option, then that will be a conversation for us to have around moving the district into that space. But from as of right now, that hasn't been a conversation. I think the other part too is, even as we talk to our health officials and folks, the recommendation is also that it's important. Schools are a safe place for children to also be able to be in a space where it's even a little more controlled around keeping protocols and cleaning hands and those things. Sometimes certain children go back to communities where it's a little bit more challenging for that, or they're interacting with different folks in different ways, which actually also promotes the spread of the virus. And so I think, what's always tough sitting in the superintendency or Madam Vice President in the board seat is that, we have an entire city with people who come from different spaces and resources and supports. And so at times we carry the burden of schools on trying to figure out how we can support all of our families, regardless of, where they are in their circumstance. And so, and we're also feeding families too. I think whenever we don't have schools open, we also have children that don't get food to eat, right? So it's a lot of different moving factors. And so, so it's just a matter of us trying to think through again. But to answer the question, the goal will be, if the governor makes that, then we'll have a different conversation. But I do think we'll be more planned to go virtual just from lessons we've learned from last year.
Okay, and it is 7:30, it's 7:33. And again, as I mentioned to you all, in the interest of respecting everybody's time that came and showed up to assist and make sure that everybody gets questions and concerns answered and hear what the district is doing. I appreciate y'all. I'm gonna go ahead and do what I'm gonna do is I'm attempting to capture all the 46 questions that are left. Okay, we'll be here till midnight. Okay, and it's just not the best use of our time. I'm cutting and pasting, and I think it's actually another feature in Zoom that I don't even have to do that. But regardless, I'm capturing all of these remaining questions. I'm gonna send it to the superintendent and his staff. And what we'll do is we'll post it on the website, maybe a link next to the FAQ, or maybe you want to update the FAQ. I don't know, with the answers to the questions that have not been, that we've not been able to answer. And so with that, I just want to say, wait, it was one more, it was a couple of questions that will, let's get done right now. One is around sick leave for educators. I had used my sick leave days before school even started. Could have, it could have been, okay. Is there any consideration being given? Is there any consideration, and this will be our last question, because again, 40-something questions, we're just not able to answer all of them right now. Is there any consideration being given to require EBR staff to vaccinate, as Our Lady of the Lake has announced, and as the LSU system will require upon FDA approval? And that'll be our last question for the night.
Yes, again, as I stated before, I made a request to the board concerning my authority to make requirements around vaccination and those things. And so it will come down to the board on the authority that they're going to give me to be able to mandate. So as of right now, that my recommendation has been to show proof of vaccination or get testing. And so, and trying to be respectful of folks in their decision, even though I strongly encourage, similar to what you heard Dr. Bolton and other folks, to get vaccinated. So if that is something that the board authorizes the superintendent, myself, to do, then that will be something we will actually do. But we have a process in place to actually do, to go down these roads based on the board's decision. So we will know on August 19th, that decision.
Okay, thank you very much. Thank you, Superintendent, for your time. And Dr. Bolton, I know you're in your kitchen being Chef Boyardee. We didn't have a particular question for you, but we appreciate you sticking around for us.
Yeah, sure, no problem. Thank you for the opportunity. That was great questions and great answers.
Thank you so much. Board President Tapman, any last thoughts? He might have had to step away. Okay, so no last thoughts from Board President. Again, I'm Madam Vice President of East Baton Rouge Parish School System. I wanted to do my part to address people's concerns as best as I could, with everything changing so rapidly and so many changes in terms of how the pandemic is affecting us and then of course the impact to our schools as a result and the changes we are having to make in the school system. Again, if I didn't get to your question, I have cut and paste and put on a 4-page document all 46 questions that are remaining, and I shall email that to the superintendent and his team tonight, and they'll get that out on the website either in addition to the FAQ or merged with it, or a separate link in response to questions from the town hall, whichever makes the most sense. But it'll be on the EBR schools website. That's the most efficient way to get you to see the answers, as well as anybody else who have those same questions and need to see those answers. All right. Thank you again so much for you all's time. I appreciate it. And good night and good luck. Feel free to email me directly as Vice President, whether you're in District 4 or not. If you have any private concerns that you feel like you need to share with me that need to get addressed, my email, and I'm typing it in the chat, is dcollins1@ebrschools.org. Thank you again, and y'all have a blessed evening.